So we'll start our program pretty soon, so we won't run too late and have a lot of people needing to leave. Delighted that you all could make it today to our first Grand Rounds, sponsored by our Interprofessional Education HRSA training grant. The grant is happy to provide support for a number of interprofessional activities on campus, in the hospital, and there's a notice out in front about the next Schwartz Grand Rounds coming up, which is another interprofessional event, and it sounds very interesting, happening tomorrow from 12 to 1, so please pick up a handout or ask somebody about it if the handouts are all gone. It's over at the hospital in one of the conference rooms on the first floor. Our grant, as I said, is looking for anything and everything interprofessional that's going on campus and trying to develop initiatives. And one of the best things that we've found so far is our speaker for today. And we found him right on our faculty at the University of Illinois in Peoria. And it is Dr. Jerry Wickham, and we're thrilled to have him with us. He is currently Assistant Dean for Medical Education and Evaluation at the University of Illinois in Peoria College of Medicine. He's originally, though, from Ireland, from Wexford, Ireland. I think you'll probably pick up on that. He did receive degrees in Ireland from Carlow Institute of Technology and University of Ulster before he came to the States. And here, he's further worked on degrees at University of Iowa, and then his doctorate in education at Edgewood College in Madison, Wisconsin. The majority of his time during the past 16 years in the USA has been spent at the University of Iowa, where he did a number of types of initiatives, but among them, he developed an initiative including interprofessional education focused on simulated ambulatory care involving 5 health science colleges. So Dr. Wickham has an extensive knowledge and background in interprofessional education, particularly involving the health professions, and we look forward to his sharing this information with us today. Help me welcome Dr. Wickham.
Well, good afternoon, and thank you, Jean, for that very kind introduction, and it's really a pleasure to be here with you today. I'm so excited about the interprofessional initiatives that are happening at UIC, not only here in Chicago, but across our regional sites. And of course, next week you've got a big immersion day, and I know everyone is very excited about that and getting ready for it. So it's really a fun time to come and have a conversation with you about what has been happening over the last 5 or 6 years in the United States with interprofessional education, and then to cast our mind a little bit about what's happening presently and then what might happen over the next 20 years or so, because we are the researchers and practitioners of IPE into the future. I'm really happy to be here in Chicago today. In fact, Chicago was my port of entry into the United States back in 1997. When I was driving up this morning from Peoria, I was recalling quite vividly arriving into O'Hare Airport at 2 a.m. on a hot August night. It was actually a Sunday night, Monday morning, Labor Day 1997. I got out of the airport and I was hit by 85 degrees and humidity. I'd never experienced anything like that in my life before coming from Ireland. And I actually studied at Dominican University in River Forest, just down the road, a place where I met my wife, and she's from Iowa, and that's kind of how I ended up staying in this part of the world. So it's a real pleasure to be here today. I want to thank you all who are in the room here at the College of Nursing here in Chicago. Thank you for coming. And I also want to recognize our partners out in Rockford, Urbana, Peoria, and the Quad Cities as well. Thanks to you for joining us via video. And then those of you in the room will have questions and answers at the end. Please feel free to raise your hand and we can do that real time. Those of you out at the regional sites, there is a chat window. You can put in questions as we go along, and I'll take those near the end. So let's get going here. First of all, I've no disclosures. And then let me kind of review the agenda for the next 35 to 40 minutes, and then we'll keep some time at the end for questions and answers. I want to begin by looking and exploring the momentum of interprofessional education from about 2007, 2008 to the present day here in the United States. I want to look at some big sources, macro sources of impetus for that momentum. And then I want to spend a moment kind of engaging you in thinking about the ways in which you might identify with the 4 core competencies of interprofessional education. So moving from kind of macro, maybe external influences around IPE to your own self-initiated influences around IPE. Then I want to explore for a moment some emerging trends in the IPE literature and take a snapshot for a moment from a very interesting article that came out just over a year ago looking at accrediting bodies and what they're doing with regard to IPE presently, which I think kind of in some ways informs our practice. Then I'd like to take a look at some artifacts from the field. I'd like to look at IPE assessment, in fact, for a few minutes. And there is a handout that we provided around that, and I'll just talk about that a little bit. And it's a very diverse literature about assessment in IPE and also holds promise for us to be able to do more research and advance knowledge and the practice of IPE as we go forward. And I'll take a look for a quick moment at this very interesting one that came out from Japan, from Takeshi Yamamoto just this past fall. And then lastly, I do want to cast our eyes forward using a device that was developed in education by a compatriot of mine, Kieran Egan, and it'll help us kind of think about the future of IPE. So that's the agenda over the next 40 minutes or so. So let's think about momentum for a moment. I know I was beginning work at the University of Iowa on interprofessional education around 2005, 2006, and started seeing some very interesting things happening across the nation and indeed internationally with IPE. And so I'm going to take us through some of these kind of momentous occasions as I see them in the literature or with regard to these big organizations that drive energy. And so I'll kind of walk us through some information that came out from the World Health Organization in 2007. I want to take a look at kind of what we call the innovation imperative from the AAMC, the Association of American Medical Colleges in 2009, which in some ways prompted kind of a conglomeration of effort with the IPEC, Interprofessional Education Collaborative, which published its core competencies in 2011. I want to talk a little bit about a fantastic meeting that you can go to, perhaps, which is called CAB 1, CAB 2, 3, and 4. 5 will be in Virginia next year. But that's an important meeting, and I want to talk about that a little bit. No talk about IPE momentum would be complete without mentioning the Macy Foundation up in New York. And then also I want to take a look at what's happening at the University of Minnesota with their National Center for Interprofessional Education. And lastly, we will talk about this phenomenon that's currently ramping up, and that is the establishment of university centers for IPE at multiple different institutions. So the World Health Organization in 2007 actually framed interprofessional education around a workforce dynamic. So they were conducted a report came out in 2008 about the shortage of healthcare professionals, the predicted shortage into the future. And one strategy that they highlighted was the establishment of a study group around interprofessional education and collaborative practice. So it's interesting that the WHO framed this in terms of workforce. Those of us who work in developing the workforce for healthcare professions are really on the ground level of curriculum development and student affairs. So we began thinking about our work interfacing with students around IPE. But no doubt when a large organization like the WHO speaks, policymakers listen, and there's that trickle-down effect into our institutions. Now around the same time, and I know we'll talk about multiple other accrediting bodies and national organizations related to different healthcare professions in a moment, but certainly I know I was in the room in Boston in 2009 when there was a big focus on innovation with curriculum at the AAMC. And this became known and branded by the AAMC as the innovation imperative. This idea of urgency about innovating how we educate our learners. And part of that conversation focused on IPE. I remember very clearly several plenary sessions at AAMC that year focused on interprofessional education. In fact, most of the speakers were not MDs, they were PhDs in nursing and so on. So that was a very interesting moment over the last 5-6 years, and it drew a lot of attention to this concept of interprofessional education. Then, with all of, with this impetus from the WHO and organizations like AAMC talking about IPE at a conceptual level, the National IPEC, which is a collaborative of multiple different organizations, came out with a report in 2011 where they identified 4 core competencies of interprofessional education. This indeed moved the framework forward. It gave us competencies to think about, and we could design curriculum around those 4 competencies. And indeed, certainly the effort here, the immersion day that's happening at UIC next week and in the next few weeks at Rockford and Peoria and Quad Cities and Urbana, we certainly use those 4 core competencies as a framework to develop curriculum. And additionally, it can also be a framework to assess learning. So 4 core competencies. Number 1 was values and ethics for interprofessional practice. Now, we could spend quite a bit of time looking at each one of these, and in fact, I will in a moment delve a little bit into each one, but I just want to give you an overview of these for today, because they really do provide a strong framework for how we might go about interprofessional education. So first was values and ethics. Second was roles and responsibilities. Helping our learners to truly understand maybe the deeper level in what ways their own role might be unique from that of another healthcare professional, or indeed in what ways might they be complementary, or indeed in some ways overlap. And that insight is important. Then thirdly, and this is the one that I've done a good bit of curriculum around, is interprofessional communication. I don't know if you folks have seen the Martin Bromley video. I'm not going to show it today, but you should Google it and check out Martin Bromley. Martin Bromley is a gentleman from England who's an airline pilot. His wife unfortunately passed away in a simple procedure. 3 senior anesthesiologists in England were unable to manage her airway, and she died. And when they did the inquest in England about this event, they found that the critical root cause analysis, the critical moment in the error with being unable to save this person, was closed loop communication. So in fact, a member of the nursing staff had said to the 3 senior anesthesiologists multiple times, we have this device, and nobody responded to her. Nobody acknowledged what she said, and there was no closed loop communication. Now, Martin Bromley obviously was grief-stricken, but being an airline pilot, had been trained in human factors, trained in closed loop communication, and has taken it upon himself to work with the medical community and the healthcare community to develop curriculum around interprofessional communication. It's a 9-minute video. It's really interesting. I really encourage you to just Google Martin Bromley. And then lastly, the last core competency is teams and teamwork. And again, we call that a core competency, and there's multiple components to that, and it's very complex. So I'm going to come back to those in a moment, but they provide a wonderful framework for us to think about interprofessional education. As I mentioned, there's this meeting, Collaborating Across Borders, CAB, 1 through 4, which happens either in Canada or the United States. Last year it was up in Canada. This year it's going to be in the United States. And this meeting has been a hub of positive energy, innovation, and an opportunity to disseminate practice and research around interprofessional education. So this has been a driver of innovation in IPE. Now, critics of North American IPE prior to 2007 cited cyclical rediscovery rather than continuous development, right? And this was a criticism. And what they really meant was that in the United States we could identify several decades worth of phases where people were becoming excited about IPE, more energized around IPE, and doing more IPE at colleges and universities followed by a lapse in that phase, so kind of a drift away from IPE. And so that's referred to as a cyclical rediscovery. Perhaps to use an American term, maybe that's called spinning your wheels a little bit. And so the call was for this continuous longitudinal development of IPE at our institutions. So it presents a crucial question. Are we truly embarking upon a process of continual, longitudinal, strategic direction where the scholarship of IPE is supported, resourced, and is productive? Okay, that is a really important question for us as leaders and indeed future leaders of interprofessional education to both ask and to seek answers to. So you might wonder, you know, if we've embarked upon a sustainable process rather than cyclical rediscovery, what evidence of sustainability exists? Generally, I'm an optimist, and I've been listening very closely and kind of hearing the tone and attending to the literature, and I sit at these meetings, and I think we are on a pathway to sustainability with interprofessional education here in the United States. Certainly there are organizations such as the Macy Foundation, who is a primary funder of grants for interprofessional education. And in 2011, they had their first cohort of IPE scholars. UIC, in fact, has a scholar, Mamouna Hasnain, in obstetrics and gynecology, and you can only have one, oh, I'm sorry, family medicine, my apologies, and great to see you. You can only have one Macy scholar at each institution, so it is special that we have one here at UIC. So we think that these cohorts of Macy scholars, you know, they're going to do good work in of themselves, but they will spread the good word and their scholarship not only at their own institution but across the nation as well. The University of Minnesota was selected for the site for the National Center for Interprofessional Education in 2012. Again, having a national center that will pursue advocacy, encourage research, facilitate development of IPE is an important step in that sustainability process. And then interestingly, over the last 18 months or so, I've been noticing a rise in the establishment of university centers for interprofessional education across the nation. And I'll come back to that phenomenon in a few minutes as well. Then no doubt there has been curricular innovation with regard to IPE. And I will mention that in a moment too. I mean, we have to think about innovation not only in terms of what we do with our own cohort of learners in our own discipline, but what we do in collaboration with each other. And then lastly, the holy grail of IPE right now really is practice research focused on patient outcomes. Now, critics of IPE, people who say, you know, I'm skeptical about interprofessional education and its value to patients, are right to say we need to do more research. We need to connect the practice research with patient outcomes. I agree with that. It's interesting, though, if we're a field of scholarship that really has only had sustained development over the last 5 or 6 years, it's going to take time to move into those avenues of research. So that is something that I think is a developmental step for our field if we think of IPE as a field. So again, I like to be provocative, and I would pose the question, where is UIC with sustainability around interprofessional education? And I ask that question within a framework of thinking about where we might stand right now. I've done some research around the development of programs, and one framework we can look at is this idea of initially an initiative must have an inception phase. And what happens during the inception phase? Well, people come together, and one of the first things they have to do is develop trust. So if you think about UIC and the group that Valerie leads and others who are developing the Immersion Day for next week, they had to go through a process to begin trusting each other, to make it happen, right? And in a short period of 2 years, we actually perhaps have one of the largest IPE courses in the nation. Over 1,000 students between Chicago, Rockford, Urbana, Peoria, and the Quad Cities engage in IPE activities over the next few weeks. March 19th in Chicago, April 9th in Rockford, and April 15th in Peoria, which includes Urbana and the Quad Cities. So that inception phase, perhaps we're moving from inception to growth here at UIC. Now, as that happens, you have to begin refining the curriculum and refining the process, refining the leadership infrastructure around IPE. And then we can move into a sustainable process. In fact, it was just fascinating. I opened my email this morning when I got up early to drive up here, and I saw the email, I don't know if you've seen it today, from the provost about the sustainability initiative at UIC. And that sustainability initiative is not just about ecological and environmental sustainability, you know, energy and building use and so on, but it is about scholarship and teaching and learning. And we have to be mindful of sustainability in all of our activities. So now I want to kind of move from some of the macro sources of impetus around IPE to having you think about your own self-alignment with these 4 competencies that the IPEC put out a few years ago. And I'll do that by tracing briefly my own affinity to the 4 core competencies. And I track it chronologically in some ways, okay? So when I talk about values and ethics, I'd like you to think about, you know, if you were to try and describe the values you hold about interprofessional education, what kind of language might you use, or how would you describe that? Can you articulate ethical issues related to interprofessional education? Okay? And maybe you can't, and that's okay, but this is the learning process, okay? Then if you think about roles and responsibilities, can you, as a healthcare professional or a person who studies healthcare, can you define the role of multiple healthcare providers across multiple varied patient settings? So that's something for you to think about. No doubt you can, but it's important to think about that and be able to describe that. Then interprofessional communication. Can you utilize specific communication skills in working with other members of the team? And then lastly, can you engage specific team dynamic strategies for process improvement, right? And I like to think that as we move down through these 4 areas, it becomes more complex, perhaps. So I think we should be able to examine our own etiology of our self-affinity to the 4 competencies, okay? And we should be able to trace that over time. And we're all at different points in that, okay? So when I think about my etiology, I think about where I developed my values and ethics related to interprofessional education. Now I realize on this map it looks like Cook County is actually in the southwest of Ireland. It's kind of the 33rd county of Ireland, which is not untrue in many ways. But in the upper map there, I grew up in County Wexford in the south of Ireland. I like to think that my upbringing in a rural area where community was kind of the focus of one's social life and one's education imbued in me certain values. Okay, and when I went on to study at the University of Ulster in Northern Ireland, I think some of those values were more formalized in the educational setting. We had a very interesting conference call with a woman who's the director of IPE at A.T. Still University in Missouri, who have campuses in both Missouri and Arizona. Had a conversation with this woman a few weeks ago, a couple of months ago, about her IPE efforts at A.T. Still. It's interesting, she graduated from the University of Ulster in Northern Ireland too, a few years earlier than me. But as she and I discussed things, it was fascinating to see the resonating values and ethics around IPE that we both held. And although it may not have been explicit to us in our curriculum and our learning at the University of Ulster, I think there's something there. But then later in my life, I actually got to work for a social services agency in Lee County, Iowa, down the very southeast corner of Iowa, not too far from Peoria, in fact, where I live now. And in Lee County, I worked on a protocol called multi-systemic treatment, which was developed at Medical University of South Carolina by a psychiatrist there. And this provided me a framework for values and ethics related to IPE. And it also, because within the framework of multi-systemic therapy, I worked with multiple stakeholders with the client family. So I worked with the school system, I worked with psychiatrists, I worked with the juvenile justice system, worked with all types of different physicians who were relevant to that family's case. And that gave me great insight into the overlapping and unique roles of multiple healthcare professionals in a rural setting. So that provided me insight into those roles and responsibilities. So I encourage you to ask yourself, what is the etiology of your understanding of roles and responsibilities in healthcare? And then my work at the University of Iowa, although I had multiple responsibilities, one of the areas that I really focused on within the Carver College of Medicine was interprofessional communication, and pursued a number of curricular initiatives around that. So whereas I learned my values and ethics in Ireland and in Lee County, Iowa, and developed an understanding of roles and responsibilities within a framework of practicing in the community, I became more skilled about interprofessional communication by developing curriculum with multiple partners at Iowa. And then lastly, we also did a lot of team simulations, some of them quite simple and some of them much more complex. And this is where I became more involved in teams and teamwork. And presently, we are engaged in a number of innovative initiatives at our Jump Trading Simulation Center, which just came online last spring in Peoria, which is in the photograph in the bottom right-hand corner. So if I think about my self-assessment with regard to IPE, here's how I would frame it. I would use the Dreyfus scale of competency development across the top, moving from novice across to expert, okay? And I don't know if you know much about Dreyfus, but he was at USC and produced this famous report in 1980. And in fact, this Dreyfus scale of competency assessment is being used predominantly now by the ACGME in residency education with their milestones movement, the next accreditation system, which basically assesses people along a continuum from novice to advanced beginner to competent, proficient, and then at an expert or aspirational level. So I think that my values and ethics with regard to IPE were at a novice level pre-1991. I was born in 1974. And then it progressed over time. And so you can see in this little chart that I've tried to trace chronologically how I have developed with regard to IPE. And I can kind of draw a line there between 2001 and 2005 where things really took off for me. And that was during my kind of formative years at Iowa. And I really think we should all sit down and do this exercise and think about where we stand right now with our own competencies related to interprofessional education. And then we can think about curriculum to design for the learners in our various programs. And again, as we do that, I would have us pause for a moment and think about which competency first. I know from experience, and I know there's a big drive in med school curricula to get our learners, our students out into the clinical environment as early as possible. I mean, one of the quintessential examples is Hopkins is sending med students out midway through the second year into their clinical rotations. Iowa is starting that in January of 2015, in fact. So if you're a first-year medical student at Iowa right now you've only been there for about 7 months at this point, less than a year from now, you'll be out in the clinical rotations. Is that a good thing? Is it a bad thing? We don't really know. We think it's a good thing. But I would really encourage us all to pause for a moment and think about which interprofessional competency we should attend to first in our curricula with our learners. I would pose, do we do a good job fostering values for IPE? And then expanding an understanding of roles, developing communication skills, and then finally entering our learners into a team environment. Let me switch gears again here now and take a look at some emerging trends in the literature around interprofessional education. One of the big things that's happening and that's been documented in the literature is this accreditation push. Okay, I'm going to show you a busy slide here, and let me take a moment to kind of talk about this for a moment. On this slide here, there are 10 different healthcare professions represented. There's about 14 or 15 different degree programs represented, because nursing has several degree programs represented on this slide. And then there's 8 or 9 different accrediting bodies. This article appeared just over a year ago, doing an analysis of what kind of language exists in the accrediting documents of these organizations related to these disciplines. You'll notice, in fact, that the ACGME is not on here. In fact, the ACGME, despite the fact that they're going through the next accreditation system, does not have specific or explicit language around IPE. So that's something for us to be mindful of, I think, as we go about curricula in our residency programs. But this is fascinating. There's a diversity here. And I would pose a few questions. I referenced this article later on, and I encourage you to go look at it, because I think it is highly relevant for each one of your disciplines. But there's a few questions that come to my mind when I see this kind of information. Have the accrediting bodies talked to each other? I know some of them have, but I don't think there's been a summit of the accrediting bodies or an alignment of language around the accrediting directives, okay? And so that poses the question, should there be some type of unified yet differentiated set of common IPE standards across multiple accrediting bodies? I think that's an important question to ask, and I think, if you were to look at a place that would be a good place to be at the table in that conversation, I think UIC is certainly one of them. Not only do we have multiple professions on a health sciences campus right here in Chicago, but we have multiple regions, and we have both urban and rural dynamics in healthcare. And I think we need to be at the table exploring that question. And then lastly, I mentioned ACGME doesn't have explicit language in their next accrediting system about IPE. But I was at the ACGME National Conference in DC last week, where it was announced that the American Osteopathic Association, the DO accreditation for residencies, will merge with ACGME. And that'll be a 5-year phased implementation, but that in and of itself is an interprofessional event. So again, I think we need to spend time thinking about what will happen in terms of IPE at the residency level of education, because we know that residents are interacting with every one of your disciplines during their training and their practice. So to just kind of recap this a little bit, there are multiple articulating forces shaping what's happening in interprofessional education right now. Starting on my left, your left as well, we have our students, our learners, okay, and they are a force shaping interprofessional education. We have organizations like the World Health Organization, a major funder of IPE is Macy. Each one of you has a self-identified impetus around interprofessional education. We have the university shaping policy and initiatives. We have accrediting bodies like the LCME and all those other ones who were on the slide previously. And then lastly, we have patients across the continuum of care that are shaping interprofessional education as well. So this, in fact, when you think about it, is actually a fairly sophisticated and complex arena. So now let me take a look at some artifacts from the field. So over the last few years, there's been a renewed focus on assessment of learning in interprofessional education. And I want to take a closer look at Takeshi Yamamoto in a moment as well. Now, there is a fantastic resource that has been developed over the last year or so at the University of Minnesota National Center for Interprofessional Education. They actually developed an online repository of instruments to assess IPE learning. Initially, there was 26 of these instruments that were looked at and identified, and they are curated on their website, and most of them you can directly access, okay? So we can all kind of maybe move from just using the ripples to other more sophisticated and targeted assessment instruments around IPE. I did develop a little handout where I just plucked out 5 of those different instruments and looked at where they were developed and with what kind of samples they were developed. And it's very, very interesting. I mean, we have some instruments that were developed back in 1990 and even some who are still under development right now. What's very interesting about the literature for IPE assessment is that it's very diverse. It's diverse in terms of the types of learning that are being assessed, but it's also very diverse in terms of the samples that are being used, okay? So if you think about a sample for IPE, a sample of convenience would be a ridiculous sample in IPE because you couldn't just take a group of medical students who may be freely available to you to pilot and develop an instrument. You have to work hard at this. You've got to go across colleges and across multiple healthcare institutions to find your samples, okay? And in fact, Yamamoto, which just published in the fall, and it's in the literature right now, is an example of one from Japan where they actually probably used a bigger sample than has ever been used before and a more diverse sample of healthcare professionals than has ever been used before. And it was a mixed methods research design. So they began with an interview design, working with faculty and practitioners across multiple healthcare institutions, and then moved into an item analysis, which is a quantitative analysis, which is really fascinating. And it's fascinating to me that in the other instruments around IPE assessment, we didn't really have a scale about respecting patients. And yet in this instrument that is coming out of Japan, the first scale that is assessed with this instrument is about patients. And I think that's important. So the call is, there's this repository now that we can access and utilize and engage measurement experts from our universities and various centers at our universities to help us be more mindful and pursue scholarship around assessing learning with interprofessional education. And I think that's the important precursor to looking at patient outcomes with IPE. And by that token, we're building a very robust agenda for the sustainability of interprofessional education at our institutions. So to wrap things up here, before we get to some questions and answers, I wanted to just take a moment to think about the future. And so I read this really interesting book written by Kieran Egan, who was at Yale at the time. And Kieran Egan actually is from Clonmel in County Tipperary in Ireland, about an hour from where I grew up. But he's a few years older than me and I've never met him. But he has this wonderful device that he used. In his book, The Future of Education, he talks about the continuum of education from elementary school to second level education and into tertiary education or higher education. And what he did was, and he wrote this book around 2005 or got published in 2008, I believe, and he took this kind of fictional approach. So he placed the protagonist of this book in the year 2050. And this person who's kind of speaking to us in the book looks back at what happened with education in 2010 and in 2020 and 2030 and so on. So it was kind of prospective, retrospective analysis of education. And it was really an interesting way to think about the future. So if we were to think for a moment, it's 2014 now, if we were to think about the next 20 years for interprofessional education, what might happen? There's all types of things that we might think about. Let me just throw out a few ideas to you that I think will be important over the next 20 years or so. So this phenomenon of provosts and presidents of universities and deans collaborating across multiple health sciences colleges and thinking about solidifying and making more robust an infrastructure for interprofessional education. One of the things that's been happening is a call for a new director of IPE for a given institution and resourcing, providing a budget and a facility and staff to a university center, for example, at some institutions for IPE. I think that's a phenomenon that's occurring right now. And what will be interesting will be to kind of study that phenomenon and see how different institutions go about solidifying that infrastructure. I think there are some threats with that growth right now. For example, what really are the competencies of somebody who might be the director of such a place, and from which college should that person come, That stuff has to be kind of thought about and figured out a little bit. And there's probably some of these centres across the nation, I think it's a good idea in general, but there's probably some of these centres that are going to be established that maybe miss the mark a little bit or falter a little bit. And that, to me, is a little bit of a threat to the sustainability of IPE over time. Now, interestingly, if you think about UIC, this is a big university. It's a research institution. It has a fantastic health sciences campus right here in Chicago. But indeed, we also have a regional component. We have education programs for multiple healthcare professionals across our state. Out west, up north to Rockford, out west to the Quad Cities, and then downstate to Peoria and Urbana. So as we think about if UIC were to establish a centre for interprofessional education, how should that be resourced? Or where should it be located? I mean, should it be in Chicago? Or should it have 5 offices across multiple sites? That's something the institution's going to really have to think hard about, and then how to resource that. So again, I'm a fan of the movement for university centres, but I think we have to be careful. And I would be careful not to try and replicate what other institutions are doing. I think over the next 10 years too, we'll become much more innovative and sophisticated with our curricula and our pedagogy around IPE. Right now, there's actually a phenomenon of these big events, kind of like what's happening in Chicago next week. I think there's going to be somewhere 750, 800 students coming together. I think there's a lot of value with that kind of pedagogy. Certainly from the faculty perspective, it develops a lot of positive energy around IPE and gets faculty their feet wet with IPE. There's some limitations with that too. You wonder about sustainability. You wonder about the curriculum being longitudinal in a given program. So I think we'll have to become more sophisticated with IPE pedagogy over time. And then as we kind of build a scholarship around assessing IPE learning at the undergraduate and postgraduate level of learners, I think, you know, the next decade we got to think about connecting that to patient outcomes. And again, the critics of IPE cite that as a negative. My response generally has been, well, you know, we got to build the agenda, we got to do the work. You got to give us a little bit of time here. We need some resources to go about this, you know. And I think that may indeed, if we can connect patient outcomes to interprofessional practice, it may in fact influence the delivery of healthcare in a given setting. And I know some of that is happening right now, and those questions are being asked. So those are some of the dynamics that I envision over the next 20 years with regard to IPE. Now I would like to just kind of transition, open the floor, or indeed the chat room to questions, and let's have some discussion around IPE. So anybody on the floor here got any questions or comments or concerns? And I'll repeat the question from the floor so that the sites can hear us. Sarah.
I find that a lot of the IPE education right now is very hospital-centered, and I think one of our challenges is to get it out to community practice. What do you think about that?
Yeah, so the question is, a lot of our IPE curricula and efforts is hospital-based, and what do I think about moving it out into outpatient environment and into communities and so on? It's an excellent question. I agree with your observation that it is hospital-based. And I think that's one of the challenges we have to face and tackle as we develop learning experiences. Now, what I think is really cool, for example, with the immersion day that's happening here at UIC, we follow a trajectory of care from an inpatient, from a person showing up in the ER to an inpatient experience and surgery, in fact, through rehabilitation, a discharge encounter, followed by a home visit. And I think that's kind of special to think about it in terms of a trajectory of care. But also I think we need to spend time thinking about urban and rural dynamics. I mean, UIC is set in an urban setting, which is great, and our regional sites predominantly are in these kind of mixed rural-urban settings. So I think, yes, your question is appropriate, and it's kind of exciting to think about that. And as an institution, we have that opportunity across our network of campuses to pursue that kind of development and effort. Yes.
I think that I appreciate that we have what's going on in that kind of business. I'd like to talk a little bit about what is going on in Canada as I follow.
Sure. Yeah, very good. So the question is, we're looking at the momentum of IPE here in the United States. And there's a question that came in from Rockford, and we'll take that in just a moment. But the question is, we've looked at what's happening here. Now let's take a look at, what happened in the UK, for example, which has, in some ways, a more robust IPE effort. Indeed, Canada is often cited as being further along in the continuum. And indeed, Australia, I would include in that as well. And quite frankly, I'm not sure about other countries. I think we need to look at IPE in places, developing countries, and not just these kind of westernized powers. I think, in fact, if you look a little bit more granularly at the United Kingdom, Scotland were the leaders of IPE back in the 1980s. In fact, that's where the ripples came out of the Readiness for Interprofessional Learning survey. And that was developed for practicing healthcare professionals at the University of Dundee in Scotland. And in fact, what happened there was their National Health Service embraced the idea of IPE. And then it became institutionalized as a component of professional development for all disciplines. So that in some ways was a top-down approach. I'm not sure the same uptake exists with the national entities overseeing our healthcare system here. Though I think it's reasonable to begin looking at the Affordable Care Act and see how or in what ways interprofessional education might be relevant in that movement. So let's take a look at the question from Rockford here. We looked at other areas such as business models, higher liability organizations to put into practice interprofessional interactions, marketing, law, engineering, and so on. There are great applications to be gleaned out there. So I agree with that. In fact, I guess the one that is most relevant is the airline industry. And I mentioned Martin Bromley earlier and the human factors movement. I did work with a colleague of mine at Iowa on human factors curricula, working with medical students and PA students. I know a faculty member at the University of Illinois College of Medicine in Peoria is currently pursuing a research design in collaboration with Northrop Grumman, who has got a big presence here in Chicago, and they are a defense contractor. And this researcher is going after a grant with the DoD. And essentially what she's looking at is Northrop Grumman has developed a holodeck. So if anybody's ever watched Star Trek, you've heard of holodecks. And what they have is a fairly high fidelity avatar environment. It looks like a tent, and it's got these 3D cameras in there. And they've developed these various algorithms for, so if I walk into this holodeck environment, especially nuclear power industry, interesting, we'll have to explore that in a moment. But if you walk into this holodeck environment, you can actually interact with these algorithm-based avatars. And so what my colleague is looking at doing is doing operating room team training that is not asynchronous. In other words, traditionally you got to have multiple people show up at the same time to simulate together. If you develop algorithms and have it in this avatar environment, you could have one person show up and simulate. So the question is, will team dynamics be the same or different in an avatar environment from a real environment? And how she is going to measure that is looking at alpha waves. So in fact, we know that, and I'm not a neurological expert by any manner of means, but we do know that when teams are working well together, their alpha waves sync up. So the question is, what will happen with the alpha waves in this avatar environment? So that's an example of medicine partnering with a defense contractor, which is kind of interesting. Northrop Grumman developed this to train soldiers in combat situations. And the idea is that maybe we can translate that innovation into saving people's lives. So that's kind of interesting. I'm not familiar with what might be relevant in the nuclear power industry, but that would be interesting too. Other questions? And thank you, Rockford. Okay, so I think we're coming near the end of our time. I will be around for a little while. This is my email address. I would gladly engage with you, and I do work with the folks here in Chicago on the IPE immersion days. It's been a real pleasure speaking with you this afternoon. Thank you very much.